This segment is sponsored by the DC Department of Health. Today is September 18th, which marks National HIV/AIDS and Aging Awareness Day, reminding us that thanks to treatment, people are living longer with HIV. But many people still face unique health and social needs. And here to tell us how DC is working to meet some of those needs of their aging HIV/AIDS population is Clover Barnes, Senior Deputy Director of HAHSTA at the DC Department of Health. Welcome in. It's so good to see you.
Thank you.
Yeah. So let's start with what is good news. People are living longer with HIV. Where are we now?
We are in a much better place than we have been. We are under 200 new HIV infections in the district each year. And most of our people living with HIV, we have about 12,000 people living with HIV, are over the age of 50. They are living and thriving with HIV. The medication regimens now are more tolerable. They're one pill a day regimen. There are injectables, so you don't even have to take a pill.
Right.
So the marvels of modern medicine have moved us much further in the fight against HIV.
Absolutely. And you talked about it a little bit, but if you could go over more the current stats regarding HIV diagnosis, especially as we talk about aging, so over 50, that population.
Yes, so a little over 66% of the people living with HIV in the district are over 50 years old. We even have people who are 80 living with HIV in the district, thriving, and today is a day that we celebrate their resilience, their ability to come back and fight through all the things that they had to go through in the beginning of the epidemic. We also have people who were born with HIV, and they are affectionately called dandelions, and that is after a poem written by a lady named Mary Bowman, who was an HIV activist and dandelion here in the district. Sadly, she passed away in 2019 at the age of 30, but we still honor her each day.
You talked about some of the unique challenges, or with the older population. What are some of those unique challenges that are still faced?
Yes, so because of all the medications that people living with HIV have had to take, you know, sometimes we're not sure how different disease states will affect them. If they get cancer, will the cancer drugs still work the same way that they will in a person not living with HIV? Will their livers or kidneys be, you know, filter the medications differently because of their HIV status or their long-term use of antiretroviral drugs? And that is where some of the research and things that are happening, like in our DC Center for AIDS Research, are really helpful in understanding what's happening and how we can best take care of our people who are living and thriving with HIV.
You mentioned it, but dandelion, first of all, that's such a beautiful term, but can you tell us more about what it is to be a dandelion, where that came from, and if there are any unique challenges that this population faces?
Yes, and so some people don't know a life without HIV. Our dandelions were born with HIV, so they only know a life living with HIV. And they are a unique group of people who are actually middle-aged now, many of them living and thriving with HIV, which we're very proud of. Mary Bowman was a young lady from DC who was a poet and activist, very strong, powerful young lady who I had the pleasure to meet when I first started working in HIV here, that coined that name. She wrote a poem, a very powerful poem about dandelions. And at the Department of Health, we give an award each year for an activist, and we named it after Mary in her honor.
That's very beautiful. What kinds of services do you offer for those living, thriving with HIV here in DC?
Yes, we have a host of medical and support services that we offer for people living with HIV. Everything from support groups to medication assistance to mental health therapy, whatever you need, we try to offer it. Food bank, home delivered meals. There's an array of services available. We even have a wellness service that offers Reiki and acupuncture and things that are more holistic medicine, because sometimes you just need a little relaxation to get you back engaged in your care.
Still fighting the stigma?
Always. Always still fighting the stigma, but everybody needs to understand that HIV is not a killer disease. It's not a death sentence anymore. And if your viral load is undetectable, then your HIV is untransmittable. And so our goal is to get everyone virally suppressed in the district who's living with HIV so they can live long, happy, healthy lives.
All right. Clover Barnes, thank you for joining us.
Thank you.
We appreciate it. And if you'd like more information on how the DC Department of Health can help you, just head to dchealth.dc.gov or check them out on social at DC Health.